this is a first for me. I've not done Zoom and live at the same time. So let's call this a hybrid Medicare open enrollment presentation. And I welcome you and I thank you for joining us. We have a group here of 4 individuals from Stowe, and we also have Michael Matatia, our Stowe-based state certified Shine counselor, who's here to be helpful if after today's information sharing, you have questions or you're interested in making a change to your plan due to costs or your health has changed. Michael is happy to set up an appointment, and that can be done through the Stowe Council on Aging staff members. They help Michael with his scheduling. So I work at Minuteman Senior Services. We're based in Bedford, Massachusetts, and Stowe happens to be in our region. Stowe, Harvard, Maynard, trying to think of the other towns out here, Boxborough, Littleton. We covered this particular 495 corridor, and we also go out to Cambridge and Somerville. So our program is basically covers 18 communities. We have a group of 45 state certified Shine counselors in our service area, including Michael. Each site has, we hope to have 2 counselors available to the community year round to help people with their Medicare issues, because it continues to become more complicated and it doesn't have to be that way. Today, we're going to talk about open enrollment, which started actually on Friday, October 15th. And I know that you're all seeing ads on television and it's really confusing. Joe Namath, I haven't seen this year, but I don't know what happened to Joe Namath, but he's there. Okay. Sometimes if you can't sleep, you'll see Joe Namath late night advertising for Medicare Advantage products. I was watching last night, I was tuned into something, and you know, I saw a number of Medicare Advantage commercials. Call this 800 number and we'll help you out, and we'll help you out for free. Just as an FYI, before we do get started, all of those ads are leading to broker licensed agents. So the people on the other end are going to speak with you and they'll be friendly to you. They'll use the same tools perhaps that Medicare uses and that we offer to you at no cost through Michael and other Shine counselors, but they're going to try to hook you into a plan on the 800 number. And if all I can say about our Shine program is that in order to not make a mistake, rather than calling an 800 line and having to undo things next year, it's always better to make use of the resources that are here in your town. It's confidential, it's one-on-one, very personal. We look at your situation. We don't work for an insurance company. We're a nonprofit. So that said, I will start with our open enrollment 2021. We'll talk questions after we'll have plenty of time. This is a really quick slide deck. So I just gave you a little bit of overview about the Shine program. There's an acronym, and Michael Matatia thankfully worked on an acronym list for the state. Serving health information needs of everyone that's on Medicare. Our program works with individuals that are 65 and up that are Medicare eligible due to retirement, but we also work with a number of individuals that are under age 65, under age 60 even, that are on Medicare due to a disability. So we're open to all, anyone that has questions, and we're here to give you all unbiased information. We don't lean on one company over another. We look at your own unique situation. We look at your finances. A lot of times that dictates what you can and cannot do in terms of health insurance. And we also try to look at your situation and save you money, because there are occasions when we still see people that have MedX Gold that was back like 25 years ago, and people are grandfathered in and they're paying $1,100 a month to have that MedX Gold. They think they're getting a Cadillac product just because it's gold and they've always had it. So that's another cost savings that we can really work with people on and put them in a comparable Medigap supplement, traditional supplement, that's equal to and so much less. It could be a savings of $800. So we have an 800 number if you have neighbors, friends that you leave here today and you want to direct people to their local program. You can go through the 800 number, or you can certainly direct them to the Stowe Senior Center, where they'll be linked up with Michael. We help Medicare beneficiaries understand their Medicare and Mass Health rights and benefits. I know in some of the smaller, more rural communities, we don't have a ton of Mass Health or public benefits, individuals that are eligible for public benefits, but believe it or not, and I will tell you what the income and assets are for that, we do have people in Stowe that live on very modest incomes. They might be living with family members. We don't care where they live. We don't look at what they pay for rent or housing. We only look at their income and their assets. So if they're income and asset eligible, they're eligible for public health benefits. And it's a huge savings because it's free, basically. So we educate people on living on limited resources. And I think that these days, as we're all listening to the news, and I'm actually one that's trying not to listen to the news very often, but we're all hearing about inflation, oil, gas for your car and truck. If you drive an SUV or an Escalade, I'm sure if you've recently filled it up, it's over $100. I had sticker shock in the supermarket last Thursday when I went around my aisles to get my usual, I don't do food a lot. I do it every couple of weeks. And I noticed that they were pushing the cereal boxes in the front. There was nothing behind. And I've noticed that we've all noticed that all the costs have gone up. So we really want for people to rely on the resources that are available to them to help you, in your households, pay for housing, pay for food, pay for heating oil, and keep up. Luckily for people on Social Security this year, the first time in 30-something years, the COLA, cost of living increase, was 5.9%. That's the highest. It's usually been 1 to 2%. So in terms of Medicare 101, just the basics for people that might be new on Medicare this year, it's a federal health insurance program for people that have paid into the FICA system over the years, people age 65. It's not an entitlement. It's a benefit that you've paid for over your work history. And it was enacted first by the Johnson administration in 1962. So it's been around for quite a long time, and it's been very successful. Also, we serve people on Medicare with a disability. I like to use my own family members as an example. I have a 55-year-old sibling who is disabled due to diabetes, and that led to chronic heart disease. And she was a nurse by trade. So she is a good example of someone that's on Medicare that's also eligible for the plans that you can purchase at 65. And she has a traditional Medigap supplement due to her health issues. She uses Tufts because it's really the best plan out there. It's the only 5-star out there. So Medicare was never designed for individuals to cover 100% of your healthcare costs. There are 2 parts to Medicare, which Part A covers hospital side. If you were an inpatient, admitted as an inpatient, Medicare Part A would be the reimbursement source for the hospital. Anything that happens on an outpatient basis, whether you're having physical exam, if the doctor orders labs, you may be having outpatient chemotherapy, all of that would be covered under Medicare Part B. But A and B were only really designed to cover 80% of your healthcare costs, which is why we talk about supplement plans, Medigap supplements and Medicare Advantage supplements. and also the Part D prescription drug plans. I was involved in the SHINE program when SHINE was brand new. So I'm aging myself, and it was a long time ago, and we did not have 33 Medicare Advantage plans. HMOs were very new at that time. The state may have had one or two that were approved. All of our consumers relied on the traditional Medigap supplements, which were Blue Cross, Tufts, Fallon, Harvard. And then things started to change. The government's moving in that direction because it's a cost savings for the Centers for Medicare Services to have your care managed, just like my care is managed by Minuteman, to have you in a network, to have you use the network. It's all driven by costs. I maybe shouldn't say this, but I feel like the insurance companies are really run by actuaries in a lot of cases, and not necessarily by the clinical people that know what you need and how to keep you well. A good example of this is the Medicare Part B preventative benefits that are there for you at no cost include the flu shot, but it doesn't include the shingles vaccine. And that's been kind of a sticking point for me, because I feel like anybody over age 60 or 65 should have the shingles vaccine as part of their Medicare Part B prevention. So I'm a little bit off track, I apologize. Part C, Medicare Advantage plans combine they actually control your Medicare Part A and B, and usually in most cases, your prescription drug coverage. So it's an all-in-one, and you have to have Part A and B in order to join a Medicare Advantage plan. You have to have both A and B. So the Medicare Advantage sales people. Okay, let's put this on hold. Excuse me. This grid that I'm sharing right now is really an easy way to look at the different parts of Medicare. So A and B is hospital and outpatient services, hospital plus medical. You can add a prescription drug coverage, and that might work for people who may be in extremely good health and they decide that, you know what, I'm going to self-insure. I'm going to pick up the 20% that Medicare A and B doesn't cover, and I'm just going to go with a really inexpensive prescription drug plan this year because I don't take a lot of medication, if any. Some people do start in that way, and that's okay. It's definitely a personal choice. You can also add to it, for full coverage, a Medigap supplement or a Medicare Advantage plan, which rolls in your Part D, and you get one bill. They manage your Medicare A and B. They communicate with Medicare A and B when you join the plan at the sales level, and you're all set. You're getting everything in one bill. If you choose to have a Medigap supplement and a Part D and your Medicare A and B, you would have potentially 3 different bills coming your way. If you defer your Social Security, there would be a direct bill for Part B coming your way every quarter, and you would get a Part D and a Medicare Advantage or a Medigap bill on a monthly basis unless you auto-enrolled into bill pay. In terms of Medigap, you have 7 company choices within Massachusetts that have been approved by the State Division of Insurance. They are Blue Cross and Blue Shield, Fallon Community Health Plan, Harvard Pilgrim Health, which is actually now merged with Tufts, Health New England, Humana, and Tufts and United Healthcare. So you have Harvard recently merged in with Tufts. It does affect 800 individuals that reside in this particular area, the north of 495. corridor, all of the Harvard members received correspondence from Tufts recently that Harvard has now merged in officially. They are not automatically enrolling any members into the new Tufts plan, but they've designed a Tufts plan that's very comparable to what Harvard was providing, same physicians, same hospitals. They've added Steward Healthcare as a hospital, and they continue to add contracts so they can make this comparable, but they do not crosswalk individuals from Harvard to Tufts. They will communicate with you. They will also in the communication let you know about your state Shine program. So if you're one of the individuals that are on Harvard right now, you would want to speak with Michael Matatia to understand what your choices are. This year, Tufts Health Plan is the only 5-star supplement that has been approved as a 5-star by the Centers for Medicare Services. The same was true last year. Blue Cross used to also be considered a 5-star, but they fell off the map last year, and I'm honestly not certain why. They look at quality, customer service, a lot of different variables. But right now, Tufts is 5-star, and I'll let you know why that 5-star is important to us. In terms of Medigap, there are 2 choices: Supplement 1A and Core. The difference in these programs is the fact that with the Core program, you may have more out-of-pocket costs. And again, Michael can let you know what those out-of-pockets would be. There's a deductible where Supplement 1A doesn't have a deductible annually. So there are a little bit of this same coverage, but different cost shares. Supplement 1 was only available to people that were eligible for Medicare before January 1st. So I really don't want to talk about that unless you're on Supplement 1 now. Do you know if you're on Supplement 1? No, okay. Next year that will drop off. Open enrollment happens the same time every year. Starts on October 15th and it ends at midnight on December 7th. That's your 7-week window of opportunity to make changes to your plan. And it's a good opportunity if you've had a recent diagnosis or you've been prescribed a new prescription that might not be generic form. You're seeing your Part D prescription drug costs really change at the pharmacy counter. It's an excellent time for you to speak with your Shine counselor one-on-one and understand what all your options are, because we can use a tool that I'll share with you today to present to you on paper all of your choices, starting with low cost to high cost. And we can also show you where your drugs are tiered, because each company will tier your drugs differently. So even if it's a generic for Lipitor, which I can't think of the name off the top of my head, it begins with an A, every plan available will have a different price structure for that drug. There are other drugs that I'm aware of, like Humira, for instance, which is for autoimmune disorders. That doesn't have a generic version. So people really want to see what the costs are going to be for that drug, because it can be in the upwards of $800 a month. I talked to a husband and wife over the phone, and I've been speaking with this couple for the last few months because they were planning for retirement. He owned Lexington Wealth Management, so he's a financial planner by trade. He sold his business a year ago. His income was at its highest because of the business sale. He's taking Humira. He and his wife are paying a higher amount for Part A because of their high incomes. It's over $176,000 a year. And his out-of-pocket for he and his wife, just for Medicare Part B, is $1,100. The Humira is going to be $800. So this individual for 1 year, for 12 months, for he and his spouse, are going to be paying almost $2,000, $24,000 a year, just for Medicare Part B and his Part D drug benefit and is out of pocket, which is why you want to talk to Michael or anyone in Shine to see, especially anyone that takes a number of meds. It happens over time. You know, we have to knock on the laminate wood that we can stick with our vitamins, but that something can happen, anything can happen. So we will accept referrals up until what I do in terms of the Shine program, which operates in 18 different communities. I ask our Shine counselors to let me know when they're fully booked. If you don't make an appointment with your Shine counselor up front early on, Michael will be fully booked, and we will have to refer people to contact Centers for Medicare Services through an 800 line directly, which isn't necessarily convenient. It can lead to really long wait times and hold times. So better to do it early rather than wait until December 7th. If you do wait, you'll be talking to somebody at Medicare directly because we'll be at capacity. Anybody that makes a change now, their coverage will be effective on January 1st. So again, it's your opportunity to potentially obtain, if you're someone that takes multiple medications, obtain an accurate drug list from your pharmacy. The pharmacist is happy to give you a printout, and you can bring that to Michael Matatia or your Shine counselor if you're from another community, and they'll pop in the drugs, the dosage, and that's how we run the plan finder and get you the best results. Things can go up and down every year. The bad thing about, I'm calling it big pharma, is that the pharmaceutical companies can actually increase the cost of a prescription in the same month. The only time that they can't increase the cost of your drugs is during open enrollment. I have had people go to the window to pick up a prescription, have sticker shock because, wow, I got this last month and it was $50 less. This must be a mistake. And again, when we go back to the inflation and the cost that we're all absorbing in our home lives, this can really be a burden to people that are living on limited and fixed retirement incomes. So I want to talk a moment about the plan finder, knowing that we're sort of all in different, we're all at different levels in terms of our use of technology and our want to use technology. You don't have to use technology to work with a Shine counselor. We can run the plan finder tool for you very easily. It's all confidential. It's completely locked down. It is a website that was developed by the Administration for Community Living. It was launched 3 years ago when I was brand new to Minuteman Senior Services. It definitely had its ups and downs, as any website that the government tends to launch. We had some challenges with it. We kind of went with it. You know, we're on the end of we're the frontline people, so we're the users. Unfortunately, the users are never asked for their advice and how this operates. So we definitely had challenges with it. Last year, my second year with the Shine program was pandemic year, and our face-to-face program in 18 communities suddenly went all remote. So we really had to rely on technology. As you all know, we had to learn Zoom. We had to use our Shine meetings for all of our counselors is still held over Zoom. Plan finder, we were able to identify people that were able to use their email, make sense out of the web. We could send them the plan finder tool, and then we would say, well, let's have a look. We'll look at this together after you have a few minutes to browse around, or take a couple hours with your spouse and browse around. But we couldn't do in person. We used to be able to run the plan finder, and we can do that now for anyone. Thanks to Michael being on site, we can run the plan finder and we can give you a printout of all your results. So you can take it home, talk to your partner, and see what might be best so you don't have to make a decision on the spot. And for people that can't come to the COA because they might be homebound, I make home visits and bring my laptop and my mask and run Plan Finder, and I can PDF that and email it to a caregiver or get them a printout when I go back to the office. That's the way we've had to work. But we want to make sure that we give everybody their Plan Finder results. So again, if you go back to your homes and you have neighbors that you talk to that are homebound, maybe they're getting Meals on Wheels from us. I've done outreach to the Meals on Wheels people throughout our service area to let them know we're available to make home visits and help you with this. It is on www.medicare.gov. And the page will look like this. You can do a generic search if you're not on Medicare A and B using your zip code and popping in your prescriptions, or you can set up a My Medicare account, which will populate your information year to year. It's really the best way for people to keep their information, especially if new drugs are being added, or if you're somebody that takes maybe 16 medications, which I have seen. I've had to enter from a handwritten list one medication after another with the dosage for individuals. We want to save that information so that we can change it if the doctor takes away or adds. So you can have a mymedicare.gov account. And I don't know if anybody's signed up for their own Social Security account, but it's very similar to that, or really any user account. It's like opening up an Amazon account. Username and password, security questions. You should write down in a log your security questions and answers as a tip. I need to do that. And you should also jot down your password. If the password is forgotten, though, there is a way to retrieve it, just like all of these widgets, so we can get your information back. I do think after today, everybody should take a look at the Medicare.gov website or make an appointment with Michael Matatia so you can look at that together and set up a My Medicare account. So anybody enrolling in a Medicare Advantage plan, your coverage, as I mentioned earlier, would take effect on January 1. That includes your prescription drug coverage. Medicare Advantage has a separate open enrollment period, which can lend to the confusion. I call this sort of a do-over. It's for people who maybe didn't see their Shine counselors or come to something like this and learn what their options were. They did call that 800 number that they saw in the middle of the night, and they landed in a plan where their PCP, their primary care doctor, isn't part of the plan. Their hospitals aren't in the network. There's any number of reasons. They made a mistake. They joined the wrong plan. Some people do see a number of specialists, and just because your primary care doctor accepts one plan doesn't mean all those specialists have contracts. On our end, as Shine counselors, we get frantic calls. I made a mistake. They don't take my doctor. I can't make an appointment. To hopefully avoid that, you will see your Shine counselor and make good choices. But if you do this on your own, using maybe the, getting taken in by the constant bombardment of advertising, you get a do-over between January 1st and March 31st to change your Medicare Advantage plan to a plan that accepts and contracts with your doctors and hospitals. So that's just an FYI in the event that you know people that are in that situation. We have a question.
So it's a separate thing from Medicare Advantage?
No, WellCare is a Medicare Advantage plan, and they are on a sheet that looks like this that our counselors refer to, and they're all listed in the Plan Finder. There are 11 companies in Massachusetts selling Medicare Advantage plan, with WellCare being relatively new. They used to just be a Part D. Those 11 companies, which is why we put a matrix together for our counselors, those 11 companies sell 33 plans. So if you're not overwhelmed looking at this, I mean, I would be. And you also have to consider the fact that we have many elders in the community. Minuteman Senior Services, we work with people that are over 100. Our oldest client is 105. Our clients all still live in the community. So imagine trying to walk through this. If you're vision impaired, it's not going to happen. So the case managers at Minuteman Senior Services refer to me directly. We need Shine help. So that's why we're here. There is an example on this slide. For instance, the primary care physician belongs to a medical practice and they drop out of their contract. They drop their contract. I don't know why they would drop a contract. I don't know the legalities of them dropping a contract in the middle of the year, but it did happen at Worcester Medical Center a couple of years ago, and it affected thousands of people. All of those individuals had to, they were notified by letter that UMass Memorial was no longer accepting a certain plan, and that they would need to choose a new Medicare Advantage or a new Medigap supplement. Individuals can also make use of special enrollment periods that happen throughout the year. Things may change in your life. Last year, due to COVID, for example, I saw a number of individuals that were laid off due to COVID. They were over 65. They didn't expect to not be working. Healthy people that said, I plan to work until I was 75. I was fine, but COVID, downturn, unemployment, all of a sudden they're laid off and they're on COBRA or they're being offered COBRA. COBRA doesn't work if you're eligible for Medicare Part A and B. COBRA is your employer group health plan, and they want you to join A and B to get you off their rolls. A lot of people also don't want the expense of having to COBRA their health insurance. If they're eligible for A and B, it's more cost effective than paying up to $2,000 or more, the full cost of your employer group plan. At any rate, we did see a lot of people that were being affected by employment. Medicare is there for you at age 65, and the employers are going to expect for you to make use of it. If you're an employer that has less than 20 people working, you don't have to offer an employer group health plan. So again, if you turn 65 and you're staying with a small employer, you need to make use of Medicare and apply for Medicare Advantage and a Medigap supplement and or Part D. You may also leave the service area. You might move down south. Our program is a national program. It's referred to as Shine in Massachusetts, but there are SHIP programs throughout the country. So if you were to move down south to get out of the weather, or if you spend more than 6 months out of the Mass area or the service area, you would receive a special enrollment period. So you could select a new plan due to a move. So there are qualifying events, and they are listed on the Medicare.gov website that will allow you to have a special enrollment period throughout the year. You can also make use of a little loophole that we call in Massachusetts Prescription Advantage, and that is for individuals who are seeing their cost of drugs really become unmanageable, even with a Part D supplement. They can join Prescription Advantage. It has fairly high income rates. It has no asset level. That provides anybody with a loophole to join a 5-star Medigap supplement or Medicare Advantage plan throughout the year. So if you kind of throw your hands up and say, wow, now I have a chronic illness that's costing me a ton of money, and this having no Medicare Advantage isn't working for me, I need something fast. That's your opportunity to get out, to get something. This has happened. We have an individual who works as a Shine counselor. He's funded by Leahy, which is now Beth Israel. And he works with people that are at Winchester Cancer Care Center that are on very expensive medications due to their diagnoses. Mark Human is his name. He has actually come upon people that came into the cancer care center for their first treatment and let him know, or the social worker would let our counselor know, this person has no insurance. They don't have Part D. It's maybe a $12,000 treatment. It's going to be a $12,000 treatment every week for the next 10 weeks. Mark Human has done wonders. He has been able, and all of our counselors can do the same thing. We use him as sort of a guru to guide us through these expensive medications, but he's been able to push off someone's treatment, working with the social worker and the physician, and get them enrolled in a plan that's going to cover that treatment and save them $12,000 up to over $100,000. In one case, an individual came to him that needed the treatment. It could not be put off. Her out-of-pocket, excuse me, her out-of-pocket costs were $8,000 for the first treatment. But after that, her coverage kicked in to pick up the Part B step therapy and her Medicare Advantage, she was enrolled in everything that she needed. There are programs that can help individuals cover healthcare available. They're considered public health benefits. Our Shine counselors screen for public health benefits using a tool that's offered to us by the government. Every April, they determine the income and asset levels for various benefits. I'll just let you know quickly, Mass Health is a program that's, pretty much birth through death. You're eligible for Mass Health if you're considered low income. If you're 65 and over, that income happens to be $1,074 for an individual. As a couple, you can earn $1,452 combined. So you can see how low the 1 month. So you can see it's almost an unlivable situation, because you have to wonder, how does somebody live on under $1,100 a month? How do they live? Even in public housing, because public housing would absorb 30% for rent. The sources of income that Mass Health counts include any income, rental income, Social Security income, pensions, veterans, railroad retirement benefits, which I've never seen, but anything that's considered income. I did have a question yesterday that I had to research about reverse mortgage income. And I learned that the individual who lives in Concord, Mass, and has the means, they have the equity in their home. They're doing a reverse mortgage so that they can stay in their home and pay their property taxes and keep up. They wanted to know if reverse mortgage income was countable, and if it's under $1,074, it's not counted. But if it's over that, they're not eligible for Mass Health. Mass Health also does kind of a dumb thing, in my opinion. They limit the assets to $2,000 for an individual, and they limit the asset to $3,000 for a couple. That kind of goes against the grain of saving for retirement or saving for the rainy day. And this amount, $2,000 and $3,000, has not changed for 35 years. That's just my editorial. I know that this is being recorded, and I'm hoping that it's not going to go outside of here. But I have to say that I find it untenable for people that are at this income level. I have heard from my counselors on occasion that, we cover a very affluent area. I've looked at the census data. I understand what the median incomes are. in areas like Stowe, Concord, Lincoln, Lexington. Those are all in our service area. There's a good deal of wealth. There are 256 millionaires that live in Concord alone. They're not just millionaires, they're multi-millionaires. I've once in a while heard from people that, we don't have anybody in our town that qualifies for this. And I always have to say to my counselors, yes, you do. They live with their sons and daughters because they can't afford an apartment. They sold a home. They've created a trust potentially. They've moved their assets out of their name, and this is their income. So yes, they are eligible for Mass Health. The good thing about Mass Health, it covers prescriptions and it covers dental. And it costs nothing. So keep that in mind. I don't want anybody to be in this situation. None of us should be in this situation economically, but it happens. We also have programs that have, these are called public health programs. They're also funded by federal government, Medicare Senior Buy-in Program. And about a year and a half ago, right before the pandemic, they did come out with a better income limit for Medicare buy-in, which means that the cost of your Part B Medicare would stay in your Social Security check. So if right now it's $148.50. And an individual earning $1,610 would be able to keep the $148.50 in their check, which would be a good savings, about $1,700 a year. And if you were earning $1,396 as an individual, you would also keep your Part B cost share in your Social Security, and the government would also pay for your Part D coverage and all of your out-of-pocket, which is really good. But again, they're all income-based, and Michael Matatia and all of our counselors use a cheat sheet that I call it, that's handed to us by the government. Every April it is updated. Right now I'm using numbers from April 2021. That's because the federal poverty level goes up in April on the 1st. So these numbers would hopefully go up next year.
That would still be, so even if you're somebody's Social Security person from $800 or $1,100 a month, and they have, $50,000 of assets, then they're out.
Yep, the asset levels are 16,000 roughly, give or take, and $24,000 for a couple. So you still have an asset limit still. It's a little better. There is also federal programs with various asset limits and income limits. It's called low income subsidy. It's managed by Social Security, and they cover the cost of prescription assistance. It's a zero premium Part D. You don't have to pay for Part D. Boy, we're having electrical problems. There are no deductibles, and their drugs can range from $3.70 up to $9.20, which is really a good savings for people. That's managed by the Social Security Administration. And all of these public benefits, we try to identify a caregiver or family member that can help complete a Mass Health application, because it's a lot for our Shine counselors to deal with Medicare beneficiaries plus public health. The only other program that would allow you to keep a little bit of money in your from your Part B, there is a new Medicare Advantage plan that was introduced this year that allows you, it's called the Give Back program. It allows you to keep $69. And I will look for that. The name of that company is WellCare. WellCare gives you a Give Back Part B of $69 out of that $148.50 that you see deducted. However, their out-of-pocket maximums are $11,300. So again, that's why you want to see Michael, because the out-of-pocket costs for all of these Medicare Advantage plans, they can start at $3,450, $3,450 a year, and they can go up to $11,300 a year. Again, this is why we don't want people calling an 800 number, because they're not going to tell you this. They're not going to show you this. They're going to say, oh, you're eligible for the Give Back program. You can save $69. People are going to say, great, how do I sign up? So Michael has this worksheet. It's not for public distribution. It's our internal guide. And again, that's why we want to refer people to Shine. The Plan Finder tool does not indicate if people are eligible for a special enrollment period if they're on low income subsidy. It does ask a question if you're receiving public benefits. So it will call that information up. It knows that it'll be intuitive. It knows that you're on low income subsidy. Anybody that's moving off the Health Connector because they're turning 65. All right, this is another editorial. Mass Health Connector should notify individuals that you are turning 65 and you're no longer eligible for your connector plan. This is for a lot of people that are self-employed. They might be consultants. They may work for companies with less than 20 people. They might be on a family plan that's just, more affordable to them than what their employer offers. So Connector has been behind the curve in notifying individuals, you're turning 65, you're no longer eligible for the Connector. You need to join Medicare A and B, and you need to hopefully speak to a Shine counselor about your other options. They need to sign up for Medicare. And we have seen people during the pandemic that weren't notified by the Connector, and they were getting a Part B penalty attached. So their $148.50 was higher because they've been on the Connector for more than 18 months. And it goes up 1% every month that you don't join Medicare Part B. So we've had to work directly with Social Security on three-way calls to explain the situation in Massachusetts. This individual wasn't notified. There was no letter indicating they had to go off Connector. We need to have that penalty removed. And we were successful in doing that and saving people that money. There's also been occasions when our Shine counselors have been able to negotiate using a program called the Medicare Advocacy Project. It sounds like a very big project in Massachusetts, but it's actually one lawyer who works in Boston. And she helps us with individuals that might have dementia. They may have other illnesses that have prevented, they just don't remember. They forgot. And it's not just because they forgot to put it on their calendar. It's because they have underlying issues and health concerns that prevented them from making decisions. And we've helped people like that get their Part B penalties and Part D penalties lifted. And we've helped people in their 90s that were paying considerable amounts for Part B. So that's another area that Shine can get into. Anybody new to Medicare turning 65, which I don't know if we have people like that on our call today, if you're still working and you're moving into Medicare in the next year or so, you do have to keep in mind that you need to stop contributing to your health savings account at your work 6 months prior to joining Medicare, or you're going to have tax liability. In Massachusetts, we are one of the only states that has a My Ombudsman program. This line is used for people who are having conflicts with Mass Health. They investigate, they mediate. It's sort of a go-between. It's when Shine has kind of done their job. We've gone as far as we can. we need to move this person to my ombudsman because it's a mass health issue that has to be negotiated further and resolved. So that's just added information that people on this call may not use, but you might know someone that it would be helpful for. So in terms of today and talking today, and I'll be happy to answer questions, don't miss your deadlines. Don't wait until midnight, December 7th or 11:30 p.m. We're available, we're here now, but we're going to be maxed out at capacity and we'll be referring you to Medicare directly. And as Michael knows and has been learning, working with Medicare is not necessarily the easiest. You could be on hold for a couple of hours. Our Shine counselors do have unique IDs assigned to them to hopefully cut through some of that on the other end so we can get to a live person faster, but that isn't always a guarantee. So absolutely. Okay, so the last slide, Michael's great, and we work as a team. Michael's gonna say SOS, I'm slammed. I only have so much time. Most of our volunteers are busy people. They volunteer for other things. When he's full, he's gonna let us know, and we're gonna hopefully call in some supports. We can also do counseling over the phone. The last slide is you have our telephone number, you have the Medicare line, and if you're new to Medicare, you have Social Security. And this mass pharmacy program is a great resource if you're finding yourself in a situation where your pharmacy costs are just enormous. They can link you up with the pharmaceutical company's foundation and hopefully get you some relief financially. And that is it.